The differentiation between an optometrist and an ophthalmologist can be really confusing. I think the best way to think about that is the preliminary studies. So when you think about the training that doctors go through to be able to have the accreditation that they have, after undergraduate studies, the ophthalmologist will go to medical school, and then they do an ophthalmology residency. Whereas an optometrist after undergraduate studies will go to optometry school. Both programs are 4 years with a residency afterwards. When it comes to our practice at Art of Optics, we employ 3 full-time optometrists, but we are constantly working with other people in our field, including the ophthalmologists in the area. One thing to think about is who can manage your condition. So my recommendation is if you are looking for a comprehensive eye exam, for someone who can answer your questions and give you an updated glasses prescription and take a look at the whole health of your eye, start with an optometrist. We will refer to ophthalmologists when necessary to manage those diseases or a condition that needs surgery. That's the biggest reason to send someone to an ophthalmologist, is if they need a surgical procedure. An example of that would be cataract surgery. That's the one you hear about the most. And we co-manage those procedures with ophthalmologists in our area every single day. You can still have all of your pre-op and post-op exams with your comprehensive eye care provider, but the surgeon would be an ophthalmologist. Another reason to refer someone off to an ophthalmologist would be retinal surgery. And those are usually emergent eye care needs. And then they will manage the patient moving forward and send them back to us when they're ready for ongoing care. Now you think of other ocular diseases, glaucoma, macular degeneration, dry eye disease, urgent or emergent concerns, and those can be managed by whomever you have established care with. I usually say, when you have an eye problem, go to an eye doctor. So it helps to see if you have a red eye, a sudden change in vision, you're gonna seek out the person you have established care with, and hopefully that's the providers here at Art of Optics. And then if a surgery is appropriate, we would refer you off to an ophthalmologist. Another O word, opta word, that we hear with people having some confusion with is an optician. And our opticians are the experts up front who will help fit glasses and get the lenses put into your frames. They go through rigorous studies and tests to be able to be credentialed in the state of Minnesota so that they can really accurately select the right lens style for each of our patients. There's a lot of science that goes into the background of lens production, and at Art of Optics we're able to utilize those skills and details in order to make sure that each selection is correct for that patient's prescription and lifestyle. When it comes to collaboration, that is so important for us at our practice. There isn't one right choice for everybody, but we would be happy to walk anyone through making that selection that's right for them.